Another shift in strategy from officials in the fight against COVID in an effort to drive the case numbers down and keep the latest variant from taking hold. Toronto is once again ramping up efforts in neighborhood hotspots to get more people to clinics like the one behind me or take it right to their doorstep.
There's an old adage that no one is safe until everyone is safe. And that's the case with the Delta variant.
Once again, it's a race of vaccines versus variants and a hyper-local focus to get people their shot. Areas like Thorncliffe Park, considered a hotspot throughout the pandemic, once again, the focus for rollout.
It's not good enough to have 80% of Torontonians having got their first dose if pockets of our city have low vaccination rates, because then the Delta variant can take hold. We need to be really targeted, really data focused here to identify those areas where the Delta variant exists and to get those second doses in arms now.
City officials claim its first sprint strategy helped to get more needles in arms where they were needed in April by working with healthcare partners and community organizations.
They did everything they could to lower all possible barriers, like language barriers, technology barriers, communication barriers, mobility barriers, with pop-up clinics, with mobile clinics, with really meaningful community engagement, and it worked.
This time, adults in 18 different Toronto postal codes will be encouraged to get their first dose if they haven't already. Others will be able to get their second shot in their community if they qualify.
We are taking the vaccine to the community. We are going building by building. We are also have the mass vaccination, which people can still book appointments and do that. But we want to make sure that we are visible, that there's no barriers whatsoever.
Just 65% of adults in Thorncliffe Park, for example, have had their first dose of a vaccine, compared to an average of 73% across the city as a whole. All the more reason for another push, what the city calls a sprint, before another wave takes hold.
You really have got to get back to those communities that have been disproportionately impacted by the virus, continue to keep those barriers low to get people out for a second dose, but also to continue to get first doses in.
Toronto Public Health estimates 157,000 people 18 and older in the postal codes mentioned are still unvaccinated.